I had had a cold, just a cough that really lasted only about 2 days, but then after that I noticed some left-sided pain that wasn't going away. Figured that this wasn't right and it wasn't getting better, so I wanted to get it checked out. I learned from my primary care doctor that I had imaging that was consistent with pancreatitis, and I did see a GI in a different system who said, yes, we need to do an endoscopy. After the endoscopy, there were no other findings, and so I had also made an appointment with Dr. Komanduri at Northwestern.
At the time Alex came to see me, there was confusion as to what was causing his pancreatitis. We offered to go back and take another look with the endoscopic ultrasound, and what we saw was a small growth in the pancreas.
My father actually died of pancreatic ductal adenocarcinoma, and the thought of having to fight a really aggressive cancer that has a very low 5-year survival rate, even if that was a possibility, that was a lot to have to think about and work through.
When we took the biopsy of this lesion, this came back as what is called a neuroendocrine tumor, which is very different than a typical cancer of the pancreas or what we call adenocarcinoma. And ultimately it really does change the outcome in terms of what the management is for this. A neuroendocrine tumor is what we call much more indolent or slow growing and not aggressive, which really does lend itself to removal. So in Alex's case, he was very lucky and ultimately had this removed completely and cured from his life.
I'm just really grateful for my team at Northwestern. They have just been amazing.